I'm Bill Hansen. I'm an anesthesiologist and intensivist and the Chief Medical Information Officer at Penn Medicine.
Hi, my name is Subai Aranjavia. I am a hospitalist and a clinical informatician. When we first started with CareAlign itself, it's actually Bill who said, we need to get rid of paper.
The patient information was dated as soon as it was printed, very difficult to read.
It's so hard to find information, and people are doing a lot of this work either on paper or in sticky notes or in text messages or in email, and having one consolidated place where you can do all of this planning actually makes it a lot easier to then bring it into the chart.
We were handing off sheets of paper, large amounts of sheets of paper, reams of paper. So we thought we would develop a mobile, up-to-the-minute application that would allow for the same function and allow teams to collaborate and coordinate. We wanted to have an ability for teams to keep up to date with tasks, with issues that needed to be addressed.
And we started with this goal, but really what it became was a team collaboration platform throughout the day, because things change hour to hour, minute to minute. So it really became a rounding tool, a handoff, a task list, a lot of different things wrapped up in one.
This is the kind of information that is not necessarily appropriate for an electronic medical record. There are a lot of things that are just custodial tasks that need to be done during the course of the day. Check on somebody's potassium, follow up on the x-ray, call the other hospital for lab results that we're aware that were done, we don't know the results of. There's a bunch of housekeeping issues like that.
One of the things is that it's very interdisciplinary. So when we first started building CareAlign, we thought it was going to be just for the doctor teams. What it turned out to be is really more of a workflow platform for the entire clinical team.
This was very carefully a collaboration amongst several different teams in the health system. So if they said this doesn't work, we changed it. If they said we want this, we made it. So it was a very fruitful and very satisfying and frankly award-winning effort.
CareAlign people are actually on the same page, giving a consistent message. That has actually panned out in HCAP scores, and specifically in the HCAP scores, we see an improvement in communication with physicians, communication around medications, discharge planning, some real error-prone parts of the clinical care that you get in the hospital. So, we've actually seen an improvement in case mix index, and not about driving up any numbers. It's really about making sure that the documentation you have is complete, and the things that you want to get into the chart, you can get into the chart, whereas the extraneous information isn't cluttering it up. And it really has contributed to people feeling like they understand what's happening for patients in real time much more than they would have otherwise.